We all want our children to feel good so they can play and go to school. But sometimes when a child is sick, all we can do is try to help them feel better until the illness runs its course. That's how it is with viruses that cause vomiting. The most common cause of vomiting and diarrhea in children is gastroenteritis. It can last several days and often occurs with fever. Gastroenteritis is not usually serious, but children must be properly hydrated as they are losing fluids to make sure their condition doesn't get worse. Vomiting can most often be managed with oral rehydration therapy. This is a method used by parents and healthcare providers to give fluids by mouth in small, frequent amounts to maintain hydration. Oral rehydration can help prevent the need for IV fluids, decrease the time you might spend in the emergency department, and help prevent hospitalization. Let's talk about how to do this for children ages 6 months and older. The goal is to give just enough fluids to trickle through the stomach instead of filling it, causing vomiting to occur. Depending on your child's age, use oral electrolyte solutions such as Pedialyte, Powerade Zero, and G2, which is low-calorie Gatorade. Pedialyte is recommended for children under 2 years of age because it's more concentrated. Sports drinks that are low in sugar are recommended for children over 2 years of age. Other ways to keep liquids in your child include ice chips, broth, gelatin desserts like Jell-O, and electrolyte popsicles. Using these fluids, you can perform oral rehydration according to the following recommended schedule. For children ages 6 months to 3 years, give 1 teaspoon or 5 milliliters of fluid every 5 minutes. For children over the age of 3, give 1 to 2 teaspoons or 5 to 10 milliliters every 5 minutes. It's very important not to force more fluids than recommended. If your child starts to vomit, wait about 10 or 15 minutes and start over again with the fluids. When your child has tolerated the fluids you've been giving for 8 hours and has not had vomiting, then you can begin to advance the diet. Good examples of things to begin feeding a child after the vomiting has stopped include saltine crackers, toast, mashed potatoes, and mild soups. When your child tolerates these foods and is not vomited in 24 hours, then you can return to a regular diet. Hopefully this oral rehydration therapy will work and your child will feel better. But when a child becomes severely dehydrated as a result of vomiting, it might be time for a trip to the emergency department. Here are some of the reasons to bring your child to the hospital. No urination for 8 hours or more, no tears when crying, sunken eyes, yellowish green color in vomit or blood in vomit, or if your child also has diarrhea and you can't tell if there has been urination. This is especially important for children in diapers. Go to the emergency department if vomiting continues for 24 hours, even after trying rehydration therapy, or if your child is not alert and is too sleepy. If your child has a medical condition such as diabetes, a metabolic syndrome, or has started vomiting after a head injury, has very bad stomach pain, or if your doctor recommends it, take your child to the hospital. We're here to answer questions you may have because we want your child to feel better just like you do. And hopefully using oral rehydration therapy will do the trick so they can get back to doing the things they love.